Well, runners, today we're discussing 5 risk factors for bone stress injuries. This is Steve and Doug from the In-Training Running Center at Toowong. Our goal is to give you the best advice on running injuries, footwear, and training to keep you running. So, Doug, bone stress injuries. You wrote an article recently about it, 5 risk factors for bone stress injuries.
Yeah.
So maybe you could start with explaining a bit how they develop.
Well, bone stress injuries basically happen once you've exceeded the capacity for the bone to withstand the load. So, in simple terms, you've done more running than what your bone can handle. Over time, you can sort of increase the strength and density of your bone. The bones consists of basically the lining of the bone. You've got the hard bone on the outside, then the marrow on the inside. As you start to run a bit more, you might start to strengthen it. But as the bone's trying to strengthen it, if you try to push through during that time, like if you've had a spike, you could then end up with a weakening of the bone, which can then develop from a stress response, rest reaction, into a stress fracture, which is when there's a small crack through the bone. Certainly very painful and puts a real dampener on your running hopes and dreams.
So the normal bone adaptation process is overloaded and basically leads to a stress fracture instead of a stronger bone.
Exactly. Yeah. So it's just a matter of trying to balance your training loads with knowing when to push and when to back off.
So what sort of symptoms do you look for when you have a stress fracture compared to other injuries?
Well, commonly with bone stress injuries, you're going to get, pain that becomes worse with running. So your milder ones will actually sort of warm up, but as it becomes worse with running, there are your real red flags for running. Nighttime pain's usually pretty symptomatic as well, and also things like hopping pain. So acute loading will really stir it up as well.
Yeah, that's one of the tests we do when people come into the clinic with a stress fracture, is to get them to hop. And if they can't without pain, then it's starting to look like a stress fracture. What other ways can we diagnose stress fractures?
Well, if there's any, if there's any concern or real high suspicion and we're not 100% sure on, referring for an MRI is one of the most useful things. Often people are being referred for x-rays, but they just don't show up the sort of damage that we're talking about, because most of the time it's going to be internal within the bone, which won't show anything. And really the MRI will look at the soft tissue, the marrow inside the bone, and gives us a pretty good idea about the extent, and the helps us a little bit with the prognosis of the injury as well. So if it's a week before a marathon and you had a stress fracture, that's generally bad news.
Yes, that's right. I've had patients come in with that before, even the day before a marathon. So
it's heartbreaking.
No time to do an MRI. But what are the common bone stress injuries that occur in runners?
Well, most of the bone stress injuries you're going to see in the lower limb, so basically the knee down. Commonly we see it in the second metatarsal, which is the longest, skinniest bone in the foot generally. So you can imagine as you're loading, you're pushing off through, it's going to get a bit of stress through there. Pushing too hard, potentially if you're in old shoes, there's some factors there, will certainly stir it up. Next most common, we're generally going to be looking more at the medial shin. So your shin splint type issues, which I don't like that term, but
umbrella term for a whole bunch of injuries, but this is one of them.
So might start as a bit of tenderness along a fairly wide area of the shin, but once it starts to pinpoint down, pain with hopping, then you're heading to stress fracture territory. So watch out for that one. More serious ones though, well, it's like, aside from a couple in the foot, they're going to be in the mid thigh. So stress fractures in there or into the neck of the femur. So as it attaches into there, particularly on the compression or the distraction side of the femur, really bad news. So it takes much longer to overcome those compared to your foot and leg ones.
Yeah, so you can look at stress fractures as high-risk stress fractures and low-risk stress fractures. And the high-risk stress fractures are ones where you have compression of the bone, and they're by far the most common. And then when you have tension on the bone, that's where normal weight bearing actually pulls the fracture apart, or you can't sort of offload it through other bones. So where are those high-risk stress fractures, do you think?
Well, certainly in the hip on you said the distraction side of it. So that's much more difficult to deal with. You basically need to be on crutches for a good number of weeks to get it to calm down. So
and you're more likely to go in a boot for things like high-risk stress fractures. So like in the second metatarsal, which is sort of the most common metatarsal stress fracture, it's mainly in this spot. But if it's down at the base, that's actually a high-risk stress fracture that you put in a boot. And any of the other tarsal bones, also, you have to put yourself in a boot for a certain period of time.
Absolutely. The midfoot, it just gets too much loading during walking, and the blood supply to some of these bones is not ideal either.
So can we move to the 5 risk factors? Because one of them you've touched on already, training load. You want to explain that a little bit more?
Well, basically just trying to look at it in terms of how much running you're doing for a certain period. So we look at the chronic load, which is how much running you've done over a month to a 3 month period. If you suddenly increase that over compared to what you've done the previous month or 3 months, then you're putting yourself at risk of developing these injuries. So as I said, spike in load will encourage the bone to try and repair itself, but it's temporarily weaker while it's doing that. So
yeah, I think the other thing with the load is that when people sort of increase their training but actually don't give themselves a recovery week, so they do 5 hard weeks in a row, and your bones just can't cope with that. It needs to have a nice, easy week in the middle.
Absolutely. So respecting your recovery is really key. So
yeah.
The other part of recovery is certainly making sure you've got enough energy on board. So your body needs to refuel, needs to rebuild. And the essential part of that is really vitamin D and calcium as well.
Yeah. So they're the dietary sort of risk factors, those two. And quite common, I think, in some runners, and certainly in elite runners, probably more than others.
Absolutely. I mean, the training, 12 plus hours a week, that's taking a lot more out of the body than you're putting a lot more back in as well.
So let's just talk about the two that are probably blamed the most for injuries that aren't necessarily always the most common, and that's running technique and footwear. Those are our other 2 risk factors. So running technique, how can that actually lead to a stress fracture?
Well, when we've seen a lot of the minimalist running in the past, the barefoot shoes tend to sort of get people in running on the ball foot a little bit more. So also a little bit more common, I guess, with treadmill running too. So you might see increased load in terms of how the forefoot, and particularly that second metatarsal, is being loaded up. May then sort of reduce some of your rear foot risk injuries, but you're just transferring it from what is a fairly solid bone to fairly skinny bones. So not really, particularly if you're not adapted to it. So you can become a forefoot runner if you're a heel striker. There's not always good reason to it. In fact, it's no good reason to do it unless you had repeated injuries, but it does increase your risk if you haven't been doing it for a while.
Yeah, there wasn't a study that Lieberman did where he transitioned forefoot strikers to heel strikers and heel strikers to forefoot strikers, and then followed them for 6 months to see who got injured. And stress fractures is obviously a common injury in runners. And he found that the amount of injuries they got didn't change, but the location did. So the forefoot runners got more metatarsal stress fractures, the heel strikers got more tibial stress fractures.
Yeah, that's interesting. And to that end, and certainly footwear has a bit to do with how you're going to develop these injuries too. So as I touched on, barefoot shoes will potentially load up your forefoot a bit more. But look, maximalist shoes aren't necessarily the panacea for injury prevention. We've had 60 years of sports footwear now, being made in waffle lines and back of car parks. So but despite that, injury rates are still about the same, which is amazing. So
people just keep training till they get injured, and it's the same percentage of people. I think that's probably why.
So it's interesting. But I guess the sort of shoe you're in won't necessarily save you, but the age of that shoe might. So certainly if it's worn out, you're going to be increasing the forces traveling through your feet and legs, so potentially increasing the amount of ground reaction force that goes through there. So again, coming back to running technique, if you're wearing an old shoe and you've got a really low cadence, you're just going to be slamming your legs. Increased shuddering forces through there, maybe increasing the risk there as well. So trying to maintain a good cadence, and not overstriding and not wearing an old shoe. There's some fairly basic, simple things that most people can do to avoid it.
So when people come into our clinic to talk to us about their injuries and we think it's a stress fracture, the things that we're going to change are those 5 risk factors, isn't it? So we'll look at their training program and adapt it. And also, after they've recovered, they need an adaptation or return to training program. We'll look at their footwear, see if they needed to be replaced or if it's the wrong type of shoe for them. We might look at their running technique, and then we'll talk to them about their dietary aspects as well.
Absolutely.
So that's about it, I guess. So thanks everybody for joining us about bone stress injuries. And we really enjoy helping you out. We love running.